I'm Raj Dave at C3 2018 in Orlando, Florida, and I'm joined today by two distinguished guests who are also course co-directors of the C3 meeting. To my right, Dr. George Vetrovec, who is a professor emeritus of cardiology at VCU Pauley Heart Center in Richmond, Virginia. And to my left is Professor Imad Sheiban, also Professor Emeritus at University of Turin, and now at Pedersoli Hospital in Verona, Italy. So welcome, gentlemen.
Thank you.
Thank you.
Thank you.
Good to be here.
So we had a successful 2018 meeting. We had the highest attendance ever. A tremendous number of legends and luminaries spoke at this year's meeting. Lots of new features, including hands-on sessions, a program directors summit, Venus Summit, Limb Salvage Summit, general cardiology content. So what a successful week it has been. And thanks to all of your help, including all of our scientific committee members, to really put on such an incredible program. As you know, it's our 15th year anniversary next year. We have come a long way from where we started, and it's going to be a great show next year again in Orlando, Florida at the end of the June. So Dr. Vetrovec, our scientific advisory board meeting is coming up very soon. You give us some ideas about what to expect for 2019 15th year anniversary show.
Well, I just want to add one thing. I think saying it was a successful program this year is modest. I think it was a great program, and it'll be even better next year. I think the 15th anniversary is going to propel everyone into being really excited about it. And I think we need to emphasize, we do already, that this is really a world community of interventionalists. And many conferences have some international representation that gives a talk or not, but this is really learning from everyone around the world, and we're just got to expand that some more as we plan for next year. The other thing that was highly successful as we started this year was having the program directors meeting. The program directors really don't have a forum of where they can just sit and talk about what the issues are. And I think that's going to expand a lot next year. And I'm really looking forward to being a part of that and seeing what comes out of that. We're not going to lose the momentum on that, and I think it'll be much bigger next year.
No, I think that's absolutely right. And Imad, it's been a smashing success from international perspective. You know, we had the highest number of faculty and attendees here this year from Europe. So it was quite a European amalgam of who's who in cardiology in Europe, including EBC, EuroCTO Club, European Society, PCR Working Group. Many of these luminaries came this year. So what we're going to do next year, that's going to be even greater and bigger.
Well, actually, as you said before, it was a great meeting this year, and it is often very difficult to improve something which is really top. However, we're still having some room. I think in the international, from international point of view, I think we should invite more and more fellows, because I think this is the place where fellows should come, because this is one of the most interactive meetings I attended ever. So I think we should try to get more fellows from globally. This one. The second, I think also we should focus on more structural, maybe next year. I think we should discuss about how we can have to treat this subject, that means structural heart disease, at the top levels for next year.
Yeah, so as you know, I announced during the opening lecture this year that we are going to have a completely new track next year for structural heart. So that would really incorporate aortic valve procedures, mitral valve procedures, and all other types of structural procedures as well. So I think that's definitely an important area. It's an area of growth. Now there is dedicated structural fellowships in US, so there's certainly a community that's being built around structural heart interventions. So it certainly is very fair suggestion and very well taken. This year we have one full day of structural heart content. Along with that, we had multiple structural heart live transmissions throughout the whole meeting. So we're going to make it even bigger and better next year. Any other thoughts, Dr. Vetrovec?
I have a couple of thoughts. One is that I like your comment about this being a meeting that people can really talk about. It's a big meeting, but it's a comfortable meeting, and anyone can talk in the hall with anyone else. That's why I think it's so educational for the fellows. But going back to, just sort of what we're doing here, you've added over the last couple of years the concept of having general cardiology, which I think turns out to be brilliant. And the reason I think it's brilliant is there are a lot of what I would call comprehensive cardiologists in the United States practicing. They're passionate about intervention, but their practice setting is just such that they're just not in the cath lab all the time. They have to take care of general cardiology patients. So by providing the general cardiology section here, they have the opportunity to see and learn about the latest and greatest interventional, but at the same time, update their skills in what they have to do in addition to that in terms of general practice. So I think that's really brilliant, and I think we need to really expand that and support that.
No, I absolutely agree. We had a smashing success of the general cardiology content this year. We did 2 full days of it. We are going to do even more next year, given that there is so much interest in interventionalists attending general sessions. Also, we had several general cardiologists come in to listen to the updating cardiology, so I think it's really a great idea. Lastly, I want to talk about the new session next year for review of latest science.
I think this is great. Everybody runs to the national meetings that are specializing in late-breaking trials. Many times what's missed on that is really an understanding of what it means, because it hasn't been on the street yet, it hasn't had any experience or review, and I think this is going to be a real opportunity to really look at the new science in a different and critical way. And it's also an opportunity. There's a lot of good science that isn't a late-breaking clinical trial, and that's what we need to focus on more. We already do, but more than we have in the past. So I look forward to that.
I think sounds like it's going to be a fantastic another year for C3. So I look forward to having you all in Orlando, June 23rd next year at the Hilton Bonnet Creek for our 15th year anniversary meeting celebration. Thank you.